Hi guys, welcome back to The Dog That Saved Me. Today I'm going to be showing you guys how I've been teaching Remus how to do deep pressure therapy. So Remus's training for deep pressure therapy started day one. This is one of the most used tasks that I have. And even though he's only not quite 5 months old yet, we still work on this pretty much every single day. So day one, what we did was I brought him home, introduced him to the other dogs, let him get settled a little bit. And then I just worked on cuddling with him, holding him in my arms, cuddling with him, and having him spend that time with me as much as he would allow for. Remus! And again, encouraging him to just sit in my lap, cuddle with me. If I had a hard time sleeping at night, I'd get him out of his crate that he sleeps in, and I would lay with him on the couch, usually for 1 or 2 hours, and then by the time then he was pretty well done, and we would come back and lay back in the bed. Well, he would go back to his crate and I would go back to bed. Sorry if he looks a little bit wet. He just had a bath and he's mostly dry, but he's still a little bit damp. And so just really spending that time cuddling with him and getting him used to the beginnings of training, doing sit, stay, very basic commands. And getting used to training, getting used to cuddling, getting him used to this bonding and experience. And I did this since day one for a really important reason. When I got Alfie, he was already 2 years old. He wasn't used to this cuddling. He still really isn't. He'll do DPT for a little bit and then he's done. He doesn't feel comfortable laying on top of me for long periods of time. So one of my main goals with Remus is to get him to where he'll just lay on top of me for as long as I need him to. Whereas with Alfie, he'll hop up and I'll have to have him come back when he's a little bit more comfortable. And it's worked for me fine, but one of my main goals with him is to get him to do that all the time whenever he needs it. So after working with him for a couple weeks on basic training, getting him used to cuddling with me holding him, that's when I started working on deep pressure therapy, which the command I use is cover, but you can use any command that you want, any word or phrase that works for you, or if you even use just sign language with your dogs, again, any sign that you would want to do to work with them. So what I have here is I have a bag of Remus's treats. These are training treats. I'll either use these or his food if it's close to feeding time. But right now I just have the training treats. Alright. When I started training deep pressure therapy, and even still, I work when we're on the floor. He's still little and it just makes more sense to him. I always start him on my left side. Either I'll bring him over to a heel or he'll automatically put himself on my left side. And I put my legs straight out. And in my right hand, I usually hold all my extra treats in my right hand and hold one treat in my left. But for this command, I hold all of my treats in my right hand. And I'll put one between my finger and my thumb. And the very first time I just had him follow and I said cover. And again, I held it really low. That way he stays low. Instead of trying to jump over me, he stays low. And to keep him here, I just give him a treat every couple of seconds and let him have a treat. Let him know that he's still doing a really good job. And then to get him off, I just say off, Remus, Remus, off, off. Good. That time he just didn't see the treat. He's still learning, obviously. I mean, he's only 4-month-old pup, but that's how I've been training him. And again, after a minute, I just say cover. And automatically he goes down and he'll do cover. If you want him to stay a little bit longer, We work on intervals of a silent stay, of him just staying there silently. Again, he lays his whole body down, and he's doing a very good job. I reward him very frequently right now. We will slowly wean off of the treats on this, but I want him to really have really super good vibes about this command in particular. Just like with any command that you're training a dog, repetition is key. Just like with this command, repetition is key. Remus, off. Good. And that's how, the very basics anyways, of how you train deep pressure therapy. The next step is sitting in a chair or on a bench, on a couch, laying on the ground, however you need that pressure to be. But this is the very first step on their level to get them to do deep pressure therapy. I do it over the side of my legs. Some people have the dog come and lay on their chest. I feel very claustrophobic if a dog's right in my face. So for me, this works best for me. Again, it really depends on what you need and what works best for you. But for me, this is the best way for me to teach deep pressure therapy to him. He's obviously not trying to get up, not trying to run away. He's very focused on the task. He's laying, he's doing exactly what he's supposed to do, and that's what we want. If there's any other tasks or dog training things you guys want me to teach, to show how to teach, or to teach in particular, I would love to do that. Let me know in the comment section below. If you like this video, give it a thumbs up. If you haven't subscribed, go ahead and hit subscribe. I love you guys. I'll see you next time.
Good boy, Remus, good boy. He's a good boy.